So this is the knowledge portion of my injectables checkup video. I will be talking about the different routes of injection administration. So the first one is the intradermal injections. For intradermal injections, you must use a 25 to 30 gauge needle. Needle length is 1/4 to 5/8 inch. You normally use a 1 ml syringe. You typically go at a 5 to 15 degree angle, and the max amount of meds given is 0.1 ml. The typical sites to use for these are the ventral surface of the arm, the upper chest, or the upper back. When administering this medication, say it was on the ventral surface of the arm, you must first pull the skin taut. You must make sure that your bevel on your needle is up. You insert in the needle into the skin about an 1/8 inch in, and then until the bevel is covered, and then you insert in the medication until you see a wheal or a bleb. All right, so for the second type of medication administration, it's the subcutaneous injection. For subcutaneous injections, you must use a 25 to 30 gauge needle as well. Needle length is 3/8 to 5/8 inch. You do use a 1 ml syringe as well, or you could use an insulin syringe, and those are measured in units. So the angle depends on how much subcutaneous tissue you can pinch. If you can pinch more than an inch, you have to go at a 90 degree angle. If you can pinch less than an inch, you have to go at a 45 degree angle. And then the max amount of meds to be given in this kind of injection is 1 ml. The sites commonly used for subcutaneous injections are the abdomen, 2 inches away from the umbilicus, the backs of the arms, the anterior thigh, and then the lower back or upper buttocks. And so when you're giving subcutaneous injections, say it's on your abdomen, and say you can pinch more than an inch, so it's 2 inches away from the umbilicus first and foremost. So you pinch the skin first, and you're going to go at a 90 degree angle since you can pinch more than an inch, and then you're going to insert the needle in, you're going to release the skin, and then you insert in the medication. And then lastly, the last injection would be the intramuscular injection. For intramuscular injections, you must use a 20 to 24 gauge needle. Needle length is about 1 inch to 1.5 inch. For these, you have to go at a 90 degree angle, and the max amount depends on the muscle that you use. So for deltoid muscles, the max amount is 1 ml, nope, it is 1 ml. And then for vastus lateralis muscles and for ventrogluteal muscles, the max amount is 2 mLs. So for these muscles, you do have to make sure that you use the Z-Track method, as well as aspirating when you use the intramuscular injections. So I will be showing you where these muscles are. All right, so for the deltoid muscle, you must first find the acromion process, which is right here. You're going to put 3 fingers below the acromion process, and so the injection site will be right here. Again, when you're administering the injection, you must use the Z-Track method by pulling the skin firm, and then injecting at a 90 degree angle, just like that. And then don't forget to aspirate before administering the medication. So you aspirate, and then you inject the medication into the muscle. So to find the vastus lateralis, you must first find the lateral condyle. You put your palm on the lateral condyle, which is right here, and you're going to make an L, and then you're going to put your other hand on the greater trochanter, and then you're going to, the site of injection should be the middle third, so it should be right here, the middle third of the vastus lateralis muscle, which is right there. All right, so for the ventrogluteal muscle, you must use, you could use this technique. So you're gonna take the left hand on the right hip. You're going to put the palm on the greater trochanter. The index finger is gonna point toward the anterior superior iliac spine, and the remaining 3 muscles are going to point towards the iliac crest. So the injection site should be right here. And again, when injecting these muscles, you must use the Z-Track method by pulling the skin firm, aspirating first, and then injecting the sites. And that goes for the vastus lateralis muscle as well. And then you just have to make sure that when educating the patient, you must educate them not to massage the site or irritate the site. I would just leave the site be for a few days. And that's it.